Good evening, everyone. Welcome to LUMP's Basic Anatomy and Physiology module combined with point categories. So we would like to welcome both batches and let's start the ball rolling. So for this week, we're going to focus on surface anatomy and the 5 Shu points. But before we do that, we would like to take a look at some of the body landmarks. So pag sinabi nating abdominal, it actually refers to the anterior body trunk region, inferior to the ribs. No, that's abdominal. Acromial is the point of the shoulder. Antebrachial is the forearm. Ante-fore. Yan. Antecubital, anterior surface of the elbow. Axillary, armpit. Okay. Medyo, I think it would be more classy to call it axillary. Brachial is arm. Buccal is cheek. Okay? Next time, we're going to meet one muscle called buccinator. Yun. So you will know the functions na. Carpal is wrist. Cephalic is head. Cervical, neck region. Coxal is hip. Crural is leg. Digital would be either fingers or toes. Femoral is thigh, from the word femur. Fibular or peroneal, side of the leg. Frontal is forehead. Hallux is great toe. The plural will be hallucis. Okay? Inguinal is the groin area. Mammary, breast region. Manus, hand. Mental, chin. Nasal, nose. Oral, mouth. Orbital, bony eye socket. Palmar, palm of the hand. Patellar, anterior knee or kneecap region. Pedal, foot. For those of you who play the piano, you know what this is. Pelvic, pelvis region. Pollex. So the plural is pollicis. That's thumb. Okay? Yun. Calcaneal is heel of foot. Dorsum is back. Gluteal, your butt. Lumbar is the area of the back between the ribs and hips, or the loin. Occipital, posterior aspect of the head or base of skull. Olecranal is the posterior aspect of elbow, from olecranon. Otic is ear. Perineal, the region between the anus and the external genitalia. I think that's very easy now. Plantar, sole of the foot. Popliteal is back of the knee. Sacral is the region between the hips, overlying the sacrum. Scapular, the shoulder blade area. Scapula, no? Sural is the calf or posterior surface of the leg. Vertebral is the area of spinal column. Now, what is surface anatomy? This is also known as superficial anatomy or visual anatomy. This is where we study the external features of the body of the person or an animal. So in birds, if you like birds, this is termed topography. So surface anatomy, we deal with anatomical features that can be studied by sight without doing any dissection. So yung nakikita mo lang talaga on-site, no? So as such, it is a branch of gross anatomy along with endoscopic and radiological anatomy. So surface anatomy is descriptive science, no? So in particular, in the case of human surface anatomy, these are the form and proportions of the human body. These are the surface landmarks, which correspond to deeper structures hidden from view. So this is very, very important, especially when you locate points, okay? So let's start with abdominal. I would like to call on Ma'am Angel ko. Good evening, Ma'am Angel. Are you ready with the 15 questions?
Yes, Doc. Good evening po. Good evening,
I
classmates.
will read the question. Number
Yes, Doc.
12 is pointing to what?
Number 1 is pointing to the hypogastric region.
Number 12. Yeah, okay. Number 1.
Number 1 is pointing to the sternocleidomastoid.
Very good. Which number indicates the inguinal ligament?
Inguinal ligament is the number 13.
Wow. Number 3 is pointing to what?
Number 3 is pointing to the manubrium.
Very good. Which number is pointing to the left iliac region?
The left iliac region is pointing to number 11.
Very good. What is indicated by number 5?
Number 5 is the midclavicular line.
Ang galing. The umbilical region is indicated by number what?
Number 9.
Okay. Number 7 indicates what?
Number 7 indicates the epigastric region.
Very good. Which number indicates the epigastric region?
Number 7.
Great. Number 9 is pointing to what?
Number 9 is pointing to number 7.
No. What
No,
region?
sorry, Doc. Number 9, nalito na po ako. The number 9 is pointing to the umbilical region, Doc.
Okay. Bawal malito.
Sorry, Doc.
Number is pointing to the mid-clavicular line.
Okay. The midclavicular line po, number 5 po, Doc.
Okay. What is indicated by number 11?
The left iliac region.
Great. The manubrium is indicated by what number?
Number 3, Doc.
Okay. Number 13 indicates what?
Number 13 indicates the inguinal ligament.
Which number indicates the sternocleidomastoid?
Number 1, Doc.
Congratulations!
Thank you,
Wow,
Doc.
ang galing. Hindi pa tayo umabot ng 3 minutes. Great.
Thank you, Doc.
Now, let's go to Ma'am SP de la Cruz. Are you ready?
Good
Wow.
evening, Doc Hector.
Okay, ready ka na? Gusto ko 2 minutes lang.
Yes, Doc. I try my best po.
Okay. What is indicated by number 11?
The left iliac region,
Ang galing. What is indicated by number 2?
suprasternal nuts.
Great. The hypogastric region is indicated by what number?
Number 12,
Number 4 indicates what?
the body of the sternum.
Wow. Which number indicates the left lumbar region?
Number 10,
Number 6 is pointing to what?
sepoid process.
Which number is pointing to the left hypochondriac region?
Number 8,
What is indicated by number 8?
the left hypochondriac region.
Paulit-ulit. Okay. The sepoid process is indicated by number what?
Number 6,
Number 10 indicates what?
the left lumbar region.
Which number indicates the body of the sternum?
Number 4,
Number 12 is pointing to what?
the hypogastric region.
Which number is pointing to the suprasternal notch?
Number 2,
Great. Number 13 indicates what?
the inguinal ligament.
And finally, which number indicates the sternocleidomastoid?
Number 1.
Congratulations, Ma'am SP. Wow.
Thank you,
Galing.
Doctor.
We're all proud of you. So far, walang mali. So walang magdo-donate. Okay, let's now go to Baguio. Let's call on Ma'am Janine Chan.
Good evening,
Are you
Doc.
ready, Ma'am
Good
Janine?
evening. I hope so.
Okay, don't say hope. Let's do it.
Okay,
Which number indicates the inguinal ligament?
number 13.
Number 3 is pointing to what?
3, the manubrium.
Okay, umbilical region is indicated by number.
9.
Okay, number 7 indicates what?
7, the epigastric region.
Great. Which number is pointing to the mid-clavicular line?
Number 5,
Okay, what is indicated by number 11?
the left iliac region.
Which number indicates the sternocleidomastoid?
Number 1,
What is indicated by number 11?
11, the left iliac region.
Okay, number 4 indicates what?
The body of the sternum.
Which number indicates the left lumbar region?
Number 10,
Great. What is indicated by number 8?
number 8, the left hypochondriac region.
The sepoid process is indicated by number what?
Number 6,
Number 12 is pointing to what?
the epigastric region.
No.
Number
Number 12.
12.
Hmm.
Epi is up, hypo, gastric region.
Ay po. Isang
Ay!
mali, so that's 1,000.
Oo nga. Mahal naman, Dok.
Okay, which number is pointing to the suprasternal notch?
Super, 2.
Okay, number 13 indicates
Inguinal ligament.
congratulations. One mistake. We accept any donation. You give that to your charity, whatever there.
Ako yung
Are
charity,
Are you having
Tita.
fun so far?
Talaga, Joy, ah.
No, thank you very much.
Thank
Walang
you, Doc.
lipunan dito ha. Okay.
Yes, Doc.
Now let's go to the torso, the anterior part. Let's call on Ma'am Cheryl Bahamundi. Are you ready, Ma'am Cheryl? Ready? Are you
Ready,
around?
Doc.
Okay, can you show your face?
Hello.
Yeah,
I
okay.
think I have poor internet.
Okay. So that means we can get more donations. Okay. Okay, let's try. Sige po.
Okay.
Which number indicates the external oblique muscle?
That's number 11. Ano, number 13.
Mm-hmm. One mistake. Okay. Sige, sige. The correct answer is
Kaagad.
15. Oo naman. Okay. Number 1 indicates which muscle? Ano yung number
Number
1?
1, that's your sternocleidomastoid.
Very good. What is indicated by number 14?
That's your inguinal ligament.
Mm-hmm. Number 3 is pointing to what?
Your pectoralis major.
Great. Which number is pointing to the serratus anterior?
I think that's number 11.
Okay. What is indicated by number 5?
That's your linea alba.
Great. The deltoid is indicated by what number?
That's number 9.
Mm-hmm. Number 7 indicates which muscle?
That's your trapezius.
Great. Which number indicates the trapezius?
Oh, number 7.
Okay. Number 9 is pointing to what?
The deltoid.
Which number is pointing to the linea alba?
That's your number 5.
Great. What muscle is indicated by number 11?
The serratus anterior.
Great. The pectoralis major is indicated by what number?
3.
Yes. Number 13 indicates which muscle?
That's your external oblique.
Okay. Which indicates the sternocleidomastoid?
That's number 1.
Congratulations, Ma'am Cheryl. You may want to
Thank you.
donate to your charity.
Okay.
Okay, make it 10,000, girl. Joke.
No.
I will send my GCash.
Okay. Okay. Let's call on Sir Darwin Misola. Good evening, Sir Darwin. Are you ready?
Sige po, sir. Sige po, sir.
Okay. Yan, ready. Mukhang last time ka pa ready. Okay, walang mali ah. I'm serious. You pay 1,000 for every mistake. Okay. Let's go. Number 13 indicates which muscle?
External oblique.
Great. What is indicated by number 2?
Clavicle.
Great. Which number is pointing to the inguinal ligament?
14.
What does number 4 indicate?
Costal margin.
The rectus abdominis is indicated by what number?
12.
Number 6 is pointing to what?
Umbilicus.
Which number indicates the biceps brachii?
10.
Okay. What is indicated by number 8?
Acromion.
Which number is pointing to the acromion?
8. 8.
Ang kulit, no? Number 10 indicates which muscle?
Biceps brachii.
Okay, biceps brachii. The
Brachii.
umbilicus is indicated by number what?
6.
Okay. Number 12 is pointing to what?
Rectus abdominis.
Great. Which number indicates the costal margin?
4.
What is indicated by number 14?
Inguinal ligament.
Which number is pointing to the clavicle?
2.
Congratulations, Sir Darwin. Wala kaming mahita sa'yo. Okay, let's call on Dr. Mary Angeli Templo from Cagayan de Oro. Good evening po, Doktora. Are you ready? Oh, okay.
Yes, Doc.
Great. No mistakes allowed, huh? Okay, let's go. What is
I'll
indicated by
try.
what is indicated by number 14?
Inguinal ligament po.
Great. Number 3 is pointing to what?
Pectoralis major.
Deltoid is indicated by number what?
Number 9.
Okay. Number 7 indicates which muscle?
Trapezius.
Which number is pointing to linea alba?
Number 5.
What muscle is indicated by number 11?
Serratus anterior.
Which indicates the sternocleidomastoid?
Number 1.
Number 13 indicates which muscle?
Rectus abdominis.
Hmm.
Abdominis. Sorry.
Number 13.
Wait.
Oh, one mistake,
13.
Doctor.
Wait. External oblique.
Okay.
Ay, no,
Am I
sorry.
pressuring you? Okay. What does number 4 indicate?
Sorry.
It's okay.
Number 4 is costal margin.
Okay. The rectus abdominis is indicated by what number?
Number 13.
No,
Oh, wait.
that's external oblique.
Oh, ay, external oblique. Sorry.
States. Napiko na si Doktor. Rectus abdominis.
Rectus abdominis is indicated by,
What number?
oh, wait.
12, 11, or 13?
12, 11, 13. 12, 11, 13.
Rectus. Naka-straight yan.
Rectus
Left.
abdominis.
Straight. Rectus.
11. This is serratus.
That's a
Yeah, no, this is
rectus.
wrong. Yeah, it's 12.
Okay.
I'm not sure.
Well,
Sorry.
you should be sure. What is indicated by number 8?
Number 8. Acromion.
Great. Which number is pointing to the acromion?
8.
Which number indicates costal margin?
4.
Great. What is indicated by number 14?
Inguinal ligament.
What is indicated by number 4?
4 is costal margin.
Okay, thank you, Doctora. We appreciate any
Sorry.
cash donation. Preferably
Sorry.
okay. Sorry. Thank you, Doctora.
Thank you.
Walang pikunan ha. I know some of you probably just woke up from a deep sleep, but anyway, sige. I hope everyone is having fun. Next, let's go to the torso, the posterior part. Let's call on Ma'am Lynn Galarita. Good evening, Ma'am Lynn. Can you show your face?
Good evening, Doc.
Good evening. You sound very ready, so no mistakes allowed.
Hindi masyado.
Bawal. Mali. Okay. Number 1 is pointing to what muscle?
The trapezius.
Number 5 indicates what?
The external oblique.
Now, the sacrum is indicated by what number?
7.
Number 11 indicates what?
The scapular region.
The scapular region is indicated by number what?
Number 11.
Number 13 is pointing to what?
The infrascapular region.
Number 7 is pointing to what?
The sacrum.
The coccyx is indicated by number what?
The coccyx, number 9.
The deltoid is indicated by number.
3.
What is number 9 pointing to?
The coccyx.
The external oblique is indicated by number.
External oblique is, asan na ba? Wait lang. Number, external oblique. Hindi ko masyado makita.
I'm sure you remember kanina sa anterior.
Yeah. Number, asan na siya? Number 5. Number 5.
Okay, don't panic next time. What is number 15 pointing to?
Number 15 is gluteus medius.
Okay, number 17 indicates what?
The gluteal fold.
What is number 3 pointing to?
Number 3 is the deltoid.
Great. Gluteus medius is indicated by number what?
15.
Okay, congratulations, Ma'am Lynn. Okay. Next, let's call on Ma'am Angelita Ramos Tuwang. Ready na. Kanina pa yan. Go. Ready na, Ma'am
Hello po,
Angelita?
Doc.
Bawal magkamali.
Yes, Doc. Set B of, ano tayo, Doc? Set B of,
Okay.
torso
Number 2
posterior,
indicates
Doc.
what?
Number
Ano yung
2
number two?
is, set B tayo, Doc, no? Set B. Hello, Doc. Set B tayo,
Yes.
Doc, no? Tama lang. Okay. Question number 1 is number 2 is indicate the end of clavicles.
Great. Which number indicates the latissimus dorsi?
Number 4.
Wow.
Number 4.
Number 4 is pointing to what?
Latissimus dorsi, Doc.
Okay. External oblique is indicated by number what?
Number 5.
Great. What is number 6 pointing to?
The iliac crest.
Great. Coccyx is indicated by number.
Number 9.
Great. Wow, wala pang mali. Number 8 indicates.
The greater trochanter of the femur.
Wow. Okay. Infrascapular region is indicated by what number?
Number 13.
Number 10 is pointing to.
The suprascapular region.
The gluteus medius is indicated by number what?
15.
Wow. What is number 12 pointing to?
The interscapular region.
Okay. Sa gitna. Which number indicates
Yes.
the end of clavicle?
Number 2.
Wow. Number 14 indicates what?
The spine of the fourth lumbar vertebrae.
Number 16 is pointing to what?
The gluteus maximus.
Gluteal fold is indicated by what number?
Number 17.
Congratulations, Ma'am Angelita. Very, very proud of you. Hindi kami kikita sa'yo. Okay. Okay. Very good job. Let's call on Sir Elvis Blones. Excited, Sir Elvis? Bawal magkamali. Remember, 1,000 per wrong answer. Okay? Sandali, anuhin ko muna yung mga maingay dyan, ha? Sandali. Sino maingay dito? Okay, go. Ready? Bawal magkamali, ha? Because Sir Albert is taking down sino nagkamali. So, get ready with your GCash. Okay? Okay, Sir Elvis, let's go. Number 5 indicates what?
External oblique.
Okay, very good. Gluteal fold is indicated by number.
Number 17.
Infrascapular region is indicated by what number?
Number 13.
Number 13 is pointing to.
Infrascapular region.
Okay. Deltoid is indicated by number.
Number 3.
What is number 9 pointing to?
Coccyx.
Gluteus medius is what number?
Number 15.
External oblique is what number?
External oblique number 5.
What is number 3 pointing to?
Trapezius.
No. Number 3.
Number 3 is deltoid.
Okay. Thank you for your donation. Okay. So, sige. Hindi kami namimilit ha, nagpapakonsensya lang. Okay. Number 10, which number indicates the end of clavicle?
Number 2.
Okay. Number 4 is pointing to what?
Latissimus dorsi.
Okay. What is number 12 pointing to?
Number 12 is interscapular region.
Okay, sa gitna, as a in between. External oblique is indicated by what number?
Number 5,
Okay. The number 8 indicates?
the greater trochanter of the femur.
Okay. Scapular region is indicated by number what?
Number 11.
Okay. Congratulations, Sir Elvis, and thank you for your donation. Okay. Now let's call on Ma'am Ami Glorioso. Good evening po. Can you show your face? Are you ready, Ma'am Ami?
Be sure, not sure, Doc.
You should be ready.
Okay,
Bawal hindi ready. Sige, makikinabang kami sa
Okay
inyo.
po, Doc.
Bawal ma-stress ha. You should be
Yes po, Doc.
confident. Okay. Theoretical pa lang to. Wala pa yung practicum. Okay. Number 1 is pointing to what?
Glavelia.
Wow. Which number indicates the tragus?
Tragus. Number 14.
What is number 3 pointing to?
Nation. Nation.
Wait lang ha. Mukhang hindi. Hindi po. One mistake.
Nation septum.
Bakit kayo nagkamali dyan?
Oo nga. Oo nga, sir.
Nasal septum.
Opo,
Number 8
nasal septum.
indicates what?
Number 8. Number 8 is thyroid cartilage.
Great. Supraclavicular fossa is indicated by what number?
Number 18.
Number 12 is pointing to what?
Frontalis frontal bone.
Okay. Which number is pointing to sternocleidomastoid?
Number 16.
What is number 16 pointing to?
Number sternocleidomastoid.
Ulitin nyo. Bawal ang...
Sternocleidomastoid.
Okay. The frontalis is indicated by number what?
Frontalis 12.
Okay, great. Number 14.
Tragus.
Which number indicates a thyroid cartilage?
Number 8.
Number 18 is pointing to what?
Supraclavicular fossa.
Which number is pointing to the nasal septum?
Number 3.
Okay. What is number 10 pointing to?
Supraesternal notch.
Notch. Okay.
Notch.
Glabella is indicated by number what?
Number 1.
Congratulations po, Ma'am Ami. We
Thank you,
welcome
Doc.
any donation. The more, the better.
Thank you.
Okay, let's call on... Oh, Ma'am Darlene Federico. Good evening po, Ma'am Darlene. How is Okada?
Good evening, Doc. Good
Are
evening
you
po sa
ready?
lahat.
Did you study? Okay.
Little bit.
Okay, great. Dapat naipasok niyo sa utak niyo lahat yan na. Okay. Make us proud. Which number is pointing to the suprasternal notch?
Number 10.
Great. Number 2 indicates?
Nation.
Which number indicates the infraclavicular fossa?
Number 18. Oh.
Infraclavicular fossa. Underneath the clavicle. The
Number 20.
Okay. One mistake, Ma'am Darlene. We can donate 1K or more. Baka maintindihan. Number 7 is pointing to?
Number 7 is hyoid bone.
Oh, okay. Which number is pointing to the lobule of the ear? Very easy.
Number 15,
What is number 9 pointing to?
circoid cartilage.
Great. The helix is indicated by number what?
13,
The number 5 indicates what?
mentalis.
Which number indicates the mentalis?
Number 5,
Okay. Number 13 is pointing to what?
helix.
Which number is pointing to the cricoid cartilage? You answered that confidently earlier.
Number
Oh.
9.
Okay. Don't take too long. By the way, pag masyadong mahaba po, more than 1 second, ano po? 100. Okay. Okay? Don't let us wait. What is number 15 pointing to?
Lobule.
Great. The hyoid bone is
Number
indicated by
7,
Okay. Number 20 indicates?
infraclavicular fossa.
Great. Which number indicates the nation?
Number 2,
Congratulations po. We welcome any donation. The more the better. Diyan po si Sir Albert to do the collection. Okay, next we call on, I hope everyone is having fun. Oh, Ma'am Jeliza. Ma'am Jeliza, good evening. Are you ready?
Good evening, Doc.
Okay. Bawal dito matakot, ha? I'm sure
Only
ikaw
what's
na to.
going on, Doc.
Okay. Puro lang to surface anatomy. Okay, which number indicates a submaxillary triangle? Did you study, Ma'am Jeliza?
Number 16, Doc.
Number?
Yes, Doc, pwede umabot dito.
Okay.
Ano,
Number
Doc? Number
6.
18.
What's your answer?
Number 18, Doc.
No.
Number 18.
Bakit umabot dyan yung maxilla sa 18? Hindi na po dyan umabot yung maxilla natin. Sa ilalim ng maxilla. By the way, where is the maxilla? O sige, bigyan kita ng chance. I hope we can be more prepared next time po. Okay. Let's call on Jennifer Duran. So, okay, next time po. Jennifer Duran, good evening. Are you there?
Hello, Doc. First time,
Hello.
Doc.
Great. So it's good to see you. Okay,
Apa.
would you like to take over? Did you study?
Ano po, first time to join the Zoom po, Doc. From
Yeah,
Masbate
but
po.
I presume inaral mo na to.
Ano po? Aaralin po.
Aaralin pa?
Opo.
Sinagot mo lahat ng questions? Sige,
Opo.
try na. Okay, submaxillary triangle. Anong number?
Sorry, Doc, kasi first time ko to join the Zoom po.
Okay, pero nakikita mo yung nakalagay sa Zoom. Okay. Did you do your assignment? Is this your first time to see these pictures?
First time to join the Zoom.
Oh, first time. So, ibig sabihin,
Yeah, I think, Doc,
okay.
siya yung bago kanina, hindi siya naka-receive ng email. Bago lang siya.
Okay, pasensya na po. Okay, it's okay. So I hope you can do better next time. Sir,
Yes,
did you submit already the naka-email na po ang inyong para pagkatapos ito diretso na kayo sa musculoskeletal system. Okay, sige po.
Thank you, Doc.
It's okay po. It's okay.
Opo, sorry, Doc. Opo.
Baka hindi ka na magpakita.
Sorry, Doc.
Okay lang
Hindi
po.
po.
Thank you for being
Excited
honest.
nga po eh. Opo.
Great.
Thank you, Doc.
Let's go to Baguio once again. Let's call Ma'am Joy Enriquez.
Thank you, Doc.
Oh, you sound so prepared. Okay, bawal sa
Kasi wala pong answer sa next.
Ay, okay.
Diba? Inamin ko na, Doc, sa inyo. Actually, may sagot ako, Doc, pero hindi ko kasi sure. At least ito, medyo mas confident ako dito.
Okay, anong sagot mo dito?
Okay, wait lang, Doc, ah. Naguguluhan ako. Set C na ba tayo, Doc? This is 3. Tama po ba?
Yes.
Which number indicates a submaxillary triangle? Number 6, Doc.
Great. Number 11 is pointing to what?
Number 11 is pointing to the sternal head of the sternocleidomastoid.
Okay, ano yung dalawang heads ng sternocleidomastoid?
May ganun, Doc? May dalawang heads? Yung
Oo naman,
clavicular
ganun
head
yan.
and clavicular head and sternal head. Tama ba, Doc?
Which number indicates the nation or nation?
The nation is number 2, Doc.
Great. Number 19 indicates what?
The clavicular head of the sternocleidomastoid.
Okay, alam nyo na. The mandible is indicated by what number?
Number 4, Doc.
O, hindi pa prepared yun na. What is number 17 pointing to?
Number 17 is the trapezius.
The sternal head of the sternocleidomastoid is indicated by what number?
The number 11, Doc.
Wait. Number 4 is pointing to what?
The mandible.
Mm-hmm. Which number indicates the clavicular head of the sternocleidomastoid?
Ayun po ulit. Number 19, Doc.
Okay. Number 6 indicates what?
Number 6 is... Wait, Doc, ano number na tayo? Number 6 is submaxillary triangle.
Okay. Which number is pointing to the trapezius?
Number 17.
Hyoid bone is indicated by number?
Number 7.
Mm-hmm. What is number 10 pointing to?
The suprasternal notch.
Do you know the point that we usually put? Okay, wag na lang. Anong point? Acupuncture point. Have you tried?
Yan po yung, basta alam ko yun, yung pinapaturo ko yan sa inyo, Doc, para sa thyroid, di ba?
Okay. Number 14, the glabella is indicated by number?
Number 1, Doc.
Very good. Number 18 is pointing to what?
And number 18 is the supraclavicular fossa.
Congratulations.
Thank you, Doc.
I hope everyone is having fun. Huh? Okay.
I like this. This is like, parang Who Wants to Be a Millionaire.
Ayan. Are we all learning here? Do you like this kind? Hindi siya boring,
Yes, Doc.
diba? Oh, sabi ko nga sa inyo eh. Kesa naman magsigit tayo dak-dak. You know what? When we give lectures, I don't think all of you would be listening. Diba? Oh, so ito naman, so why don't we spend a lot of time opening your books? And mind you, we had 25 ebooks, right? Okay. Now let's call on Ma'am Lane Arandia. Let's go to the arm. Okay, now this one is getting exciting. Ma'am Lane, good evening. How are you? Ready ba tayo?
Try ko po, Doc.
Okay. Number
Pero
9.
may answer po. Okay,
what?
number 9 indicates yung braccio radialis.
Brachioradialis.
Brachioradialis, may
Okay.
answer.
Yes. Number 2, which number indicates the coracobrachialis?
Number 12.
Wow, nag-aral to. Number 14 is pointing to what?
Number 14, triceps brachii.
Triceps brachii.
Brachial,
Okay.
triceps brachii.
Okay. The triceps brachii is indicated by what number?
Number 4, number 14, hindi. Number 14 po, Doc.
No.
Wala din.
No, you have 3 options, 24, 26, or 22. Triceps brachii.
24 po.
No. Are you ready with your...
Wala po akong answer dito para.
Okay. Hindi ka nag-consult ng ating anatomy books? I think I gave away like...
Na-miss ko po siya.
Don't miss it next time, please, okay? Okay, correct. Okay, would you like to give it another try? Para 500 na lang.
Try ko po yung 26.
Very good. Okay. Sir Albert, 500. Okay. What does number 4 indicate?
Number 4, extensor digitorum.
Okay. Which number indicates the palmaris longus?
22.
Great. Number 7 indicates
Flexor carpi radialis.
okay. The brachialis is indicated by what number?
17.
No. So that's another mistake. Would you like to give it another try para 500 na lang?
Ano po, Dok? 10.
Okay. So 500. Number 17 is pointing to what?
Number 17. Brachialis.
No. Another try. Pang 500.
Okay. Number 17.
Hindi mo to ni-research?
Flexor po.
No. So, the correct answer is Anconius.
Okay.
Which number indicates the olecranon? Or
Number 16.
Very good. What does number 24 indicate?
Medial epicondyle.
The extensor carpi radialis brevis is indicated by number what?
3.
Yes. Number 5 indicates
Abductor pollicis longus.
abductor pollicis longus.
Pollicis
Okay?
longus.
That's how the lump people pronounce it. Which number indicates the flexor carpi radialis?
Number 9.
No. Hindi mo to inaral?
Number 14 po, Doc.
No. So,
Ay,
ano
mali.
na natira? 20. Okay, number 23.
Number 23.
Flexor carpi radialis. Flexor, ha? I presume alam nyo ano ang flexor. Number 15 is pointing to what?
Olecranon.
No.
Number 15. Medial epicondyle.
Okay. Congratulations. Good try, ma'am.
Oh,
Alam ko medyo na-stress ka.
yes po.
Sir Albert, can you do the collection?
Patay.
Yes, sir.
Okay. Pero okay lang kung siseryosohin nyo. Okay, let's... Oh, Ma'am Mary Jen Ladesma. Good evening po. How are you?
Hi, sir. Good
Yeah,
evening.
hello, Miss Mary Jen.
Good evening, everyone.
Yeah, I think you got
Narinig po
your...
ako.
Yes, and you sound very ready. Can we go? Okay.
Hopefully, walang donation.
Yeah, which number indicates the deltoid?
I think number 1.
Very good. Number 10 indicates
Bronchialis. Am I right?
brachialis. Okay.
Brachialis, yes.
The flexor carpi ulnaris is indicated by number what?
21.
Very good. Number 3 is pointing to
Extensor. Wait lang. Hindi ko masyado makita.
extensor carpi radialis brevis. Correct. Which number indicates the location of the anatomical snap box? Meron po tayong points sa acupuncture.
Number 6, sir.
Very good. Oy, wala ka pang mali, ah. Hindi kami makikinabang sa iyo. Okay. What
500, sir.
What does number 16 indicate?
Omicronon.
Okay. Olecranon or olecranon. Okay. The axilla is indicated by number
27.
Okay, what's the Filipino counterpart of the axilla?
Wait lang. Axilla. Asan mo? Kilikili. 27. Sabay kilikili?
Sorry for axilla.
Para sa armpit, yes.
Yeah, armpit. O, di ba mas maganda pag axilla? Okay. Number 8. Number 25 indicates what?
Cubital fossa.
Very good. Which number indicates the extensor digitorum?
Number 3.
No.
Oh, may mali.
You have one mistake.
Wait lang. Um, Let me guess again. Number 16.
No.
Ay, number 4.
Number
Siyempre,
4, extensor digitorum. Medyo mahirap na, no? Number 13 is
Yes, sir.
pointing to what?
Pectoralis major.
Very good. The anconeus is indicated by number.
17.
Very good. What does number 18 indicate?
Plexor carpi
Okay.
orlaris.
Flexor carpi ulnaris. Very good. Which number indicates the flexor carpi radialis? Kung meron tayong flexor carpi ulnaris, meron din tayong flexor carpi radialis. Anong number?
Number 7, sir.
Very good. Very good. Number 2 indicates?
Number 2, diploid. Diploid. Tama? Diploid.
Hindi. Yan yung piniflex-flex parati ng mga nag-gym.
Bicep.
Yes. Biceps brachii. Okay?
Okay, biceps.
Number 15.
Extensor
carpi
carpi.
ulnaris.
Oo. I think number 19, sir.
Very good. Wow. This is your first time? Kailan mo na-receive yung email mo?
Ano lang po, sir? Kailan lang po ba? Mga 3 days ago.
Ay nako, next time. Okay, start studying tonight. Sir Albert will email the week 2. Okay?
Yes, sir.
Medyo,
Thank you, Doc.
medyo matindi yung bago. Okay. Congratulations po. Now let's call on Ma'am Wilmela. Ma'am Wilma Villalba. Good evening po, Madam.
Dok, hindi pa ako tapos kasi nasa nasa ano po ako, medical mission dito sa Santa Cruz, Laguna.
Okay.
Ang natapos ko lang po sagutan hanggang set C.
Sige. Next time,
Kasi madaling
okay,
araw
mamayang
po
gabi
kami
mag-umpisa ka na
umalis
mag-aral, ha? Okay,
Opo,
sige.
opo. Sorry po.
Okay,
Sa ano
po,
na lang.
Madam. Sige, no problem.
Oo. Ito po, dala ko kodigo ko.
Sige po, no problem. Yeah,
Apo.
thank you. Let's call Maricel. Maricel, good evening. How are you? Ma'am Maricel? Are you there? Good evening. Huwag kayo mahiya. Hindi po ako nangangagat. Are you ready? Ma'am Maricel?
Doc, hindi ko po kasi nasagutan lahat. Yung mga sa
Okay.
una lang yung ano ko.
Okay. Sige po. Okay lang. Sagutin nyo mamaya, ha? Mamaya yung week 2. Okay.
Yes.
Let's call
Pasensya na
Michael
po.
Rivera. Thank you po. Sir Michael Rivera, good evening.
Good evening, Doc.
Okay, I hope you do not have any excuse this time. for ating-
Actually, may excuse sapat ako, Doc, eh. Kaya lang, kailangan eh.
Oo naman, bawal ang ayoko talaga ng mga alibay. Okay, which number indicates the deltoid? Go.
Number 1.
Yes, very good. Number 2 indicates?
Bicep branchi.
No, biceps brachii. Okay, can you say it again? The biceps brachii. So if you pronounce it that way, you are from LAM.
Opo, wala ka nang ngipin, Doc, eh.
Paggawa ka ng ngipin. Okay, number 3. The extensor carpi ulnaris is indicated by what number?
Exterior. Wait po, Doc. Ulnaris. Exterior ulnaris.
Extensor carpi ulnaris.
Number 9. Number 19.
Okay, very good. Number 9 is pointing to what?
Branchi radialis.
No. Brachioradialis.
Brachioradialis. Okay po.
Which number indicates the flexor carpi radialis? By the way, I'd like to remind everyone to Google the pronunciation of all the muscles it would be very pathetic if people will hear us mispronounce all the names. Okay, that's a sign of low education. So let's try our very best to really give the right pronunciation, okay? So that we can all feel confident. Okay. Flexor carpi radialis. Ano answer mo?
Number 23, Doc.
Very good. What does number 14 indicate?
Yan na. The tricep brachii.
Triceps brachii. Okay? Triceps brachii. The abductor pollicis longus is indicated by what number?
Abduction longus. Number 8.
Very good. Number 11 indicates what? Kanina pa yan.
Bicep brachii.
Diyan na naman tayo. Biceps brachii. Can you pronounce it again? Hayaan mo na mahulog yung ngipin mo. Sige, go. To pronounce it right, it doesn't matter. Okay? Can you do it again? Biceps brachii. If you pronounce it that way, then you definitely are from LAM.
Opo.
Okay.
Biceps brachii.
No. Biceps brachii.
Bicep brachii.
Ay, naku, ano ba yan? Brachii.
Brachii. Basta po nalagdag mo kasi, Doc, eh.
Hayaan mo na. Okay, which number indicates the head of the ulna?
Ulna. Ulna.
Head of the ulna.
Head of 17.
No. Wala namang 17 siya.
Ulna. Ito, 20.
Okay, very good. Number 22 is pointing to what?
22. Is palmaris longus?
Very good. Wala ka pang mali, ah. The medial epicondyle is indicated by what number?
Medial condyle.
Medial epicondyle. Ano ba yung ngipin?
Number 15, Doc. 15. No, sorry. Medial. 24.
Very good. What does number 26 indicate?
26 indicate tricep brachii.
Triceps brachii. Okay?
Yeah.
Which number indicates the cubital fossa?
Cubical fossa. Number 25.
Very good. Number 6 indicates the location of what?
6 is anatomical snap box.
Very good. The pectoralis major is indicated by number?
Pectoralis.
Pectoralis
major is
change your glasses as well. Ano ba
number 13 Doc. Kasi wala pa yung yung answer sheet ko sa
okay.
Sa PowerPoint.
Okay.
So lahat ng connection niya nakalagay na doon sa PowerPoint. Kaya lang hindi siya naisagot doon sa tamang order.
Okay. Sige, no problem po. Maraming salamat and congratulations.
Doc, you'll get 1 to 2.
I'm sorry.
Ay!
Okay.
Okay po.
Thank you very much. Let's go to the leg. Oh, malapit na tayo matapos. The leg naman. Can you mute your mics? Okay, let's call Sir Victor Ginto. Sir Victor, good evening po.
Magandang gabi po, Doc.
Okay, nag-aral po kayo?
Classmates. Yes po.
Very good. Great. Okay, prove it. Okay. Number 1 is pointing to what?
The tensor fascia latae.
Okay. Oh, wow, ang galing. Okay. Next, the gluteus medius is indicated by what number?
16.
Wow. What does number 2 indicate?
The femoral triangle.
Which number indicates the gluteus maximus?
17.
Number 3 indicates what muscle?
The sartorius.
Great. Which number is pointing to the gluteal fold?
19.
Number 8 is pointing to what?
The biceps femoris.
Wow. The rectus femoris is indicated by number what?
4.
What does number 10 indicate?
Gastrocnemius.
Okay. Which number indicates the vastus lateralis?
5.
Great. Number 11 indicates the
Tibialis anterior.
Ang galing. Which number is pointing to the vastus medialis?
6.
Number 21 is pointing to?
The biceps femoris.
No. No. 1,000. Joke.
Semitendinosus.
Very good. O, 500 na lang. Sir Albert, take that down. Joke lang. Pero pwede rin totoo. The crest of the tibia is indicated by what number?
12.
Very good. What does number 22 indicate?
Semitendinosus.
No.
Ay, nagbaliktad pala. Biceps
No.
femoris.
So, ang natira, semi-membranosus.
Semimembranosus.
Okay, 2 mistakes. Sir Albert, paki-compute. Thank you po, Sir Victor. Good job.
Salamat, Doc.
Okay, let's call Mom Charbet Schmitz. Oh, the ballerina, the dancer.
Hello.
How are you? Did you study?
Yes. I mean, lang.
Okay, prove it. Which number indicates the popliteal fossa?
The popliteal fossa is, hang on, where are my notes? Number 25.
Very good. Number 19 indicates?
Number 19 indicates the gluteal fold.
Great. The head of the first metatarsal is indicated by number?
15.
What is number 4 pointing to?
The femoris.
Rectus femoris.
Rectus femoris, yeah.
Which number indicates the lateral malleolus?
Number 13.
What does number 5 indicate?
The vastus lateralis.
Okay. The tensor fasciae latae is indicated by number? Parang kape, no?
Tensor fasciae latae. 18.
Very good. Number 28 indicates?
The medial malleolus.
Malleolus. Which number
Malleolus.
indicates the semitendinosus?
Semitendinosus. Semitendinosus is...
You should know this. Remember, you use your legs all the time.
Yeah. Okay, number 20. Somewhere in the legs. So
Yeah.
24.
Yes, very good. What is number 29 pointing to?
29 is the tendocalcaneus.
Tendocalcaneus. What is that more
Calcaneus.
commonly known as?
Number 29.
Yeah, there's another name for
The
that.
ankle?
No.
No, that's
Achilles heel.
Achilles tendon.
Achilles tendon, sorry, Achilles.
Yes.
Achilles tendon, yeah. And I'm sure you know your history, your mythology. Okay.
Yeah.
Adductor magnus is indicated by what number?
Adductor magnus. 24?
No.
I know that's the
That's semitendinosus.
20?
The 24 is semitendinosus.
Abduction and deduction, di ba?
Yeah, adductor magnus.
Adduction pa sa labas? I'm confused. If that's sa
So
labas, then
adductor,
it's 18.
papapasok.
Papapasok. Okay, then 20. Kasi lahat naman, 24 na yung pinakalabas. So, it's either 24 or 20.
20.
20, okay.
What does number 30 indicate?
Number 30 indicate the lateral malleolus.
Malleolus. Okay.
Malleolus.
Which number indicates the soleus?
Number 27.
Great. Number 14 indicates what?
Number 14 is the tubercle of the fifth metatarsal.
Great. The biceps femoris is indicated by number?
22?
No.
No? Biceps femoris, 22, 23,
This
or
is the
21.
counterpart to
21?
biceps brachii. No.
Hindi 21, hindi 22, hindi 23.
Meron siyang counterpart din sa ano, di ba? Sa...
Di ba yung fineflex sa arm? Nasa gilid
Yes.
kasi yung 23.
So, anong sagot? Then iba rin pagdating sa paa. Sa ano, sa legs. So, what's your answer?
21.
No. That's
22?
not biceps
Okay.
femoris.
Okay.
Masyado na malayo yan sa biceps. Should be a little lower.
Kasi the choices are 21, 22, 21, 22, 23 lang.
So, what's your answer?
20, 23.
Yeah, 23. Congratulations. And
Okay.
I hope you had fun.
It's hard.
Yeah, it's getting harder and harder. Oh, diba? So what's the solution there? We have to study more.
Yeah.
Thank you very much.
Okay, thank you.
Thank you. Now let's go to, sino pa hindi ko na natatawagan? Okay, let me see. I think we have to go back to the first one. Oh, Dr. Sam. Dr. Sam Reason.
Yes, Doc.
Good evening. I haven't called you yet. Okay. Bawal magkamali.
Yes, Doc. Pahingin ng account number.
10,000 per mistake. Okay, what does number 1 indicate?
Number 1 is tensor fasciae latae.
Okay. Ang ano niyan is tensor fascia
Fascia?
or tensor
Okay.
fasciae latae. Okay. Which number indicates a semitendinosus?
Semitendinosus is number 21.
Okay. Number 2 indicates?
Number 2 indicates that's femoral triangle.
Great. Okay. I want you to understand bakit yan tinawag na femoral triangle, ha? And I think you know the answer. The semimembranosus is indicated by number?
Number 22.
Great. Mukhang hindi siya magkakamali. Okay. Hindi tayo kikita dito, Sir Albert. Number 3 is pointing to?
Sartorius.
Great. Which number indicates the biceps femoris?
Ito na yung number 23.
Great. What does number 16 indicate?
Number 16. Hold on, let me check on number 16. 16 ba to? Nasaan ba 16 daw?
Dito sa may right, ano?
Number 16 is gluteus medius.
Great. The popliteal fossa is indicated by what number?
Number 25.
Number 17 indicates what?
Gluteus maximus.
Which number indicates the patella?
Number 7.
Double L, huh? Okay.
Yes.
Number 8 is pointing to?
Nawala ang sound.
Number 8 is pointing to?
Okay. Number 8 is pointing to biceps femoris.
Okay. Tuberosity of the tibia is indicated by what number?
Hold on. Hey, alis mo ka. Number 9, Doc.
Great. What does number 10 indicate?
Number 10 is
no,
gastrocnemius.
Gastrocnemius. Very good. Which number indicates the gastrocnemius?
Number 10. Ano? Indicates the...
Yes. Anong number ang gastrocnemius?
Okay. Number 26.
Okay. It's the same, no? 10 and 26.
Yeah.
Number 11 indicates what?
Number 11 is tibialis anterior.
Wow, perfect. Hindi kami nakinabang. Sayang.
Walang 10,000.
Congratulations, Dr. Sam. We're very
Thank
proud
you.
of you. And I think time for you to really do whatever project you have. I'm excited about your auriculochiral. Okay?
Yes, Doc.
Thank you, everyone. But that's only part 1. Okay, let's go now. I hope everybody had fun. Do you like it? Did you like it? Okay.
Yes,
Yes.
Game ka na ba?
Okay, so ngayon, aralin nyo na ha. We hope to finish before 9. Now let's go to the 5 Shu Points. Okay, let's call on yung pinakaunang dumating, si Ma'am Angel.
Good evening, Doc.
Good evening. What are the 5 Shu Points? Can you explain?
Okay. So the 5 Shu Points po is a transporting point, 5 types of point found in the 12 primary channel. Sila po si Jingwell, Jing Spring, Shu Stream, Jing River, and Hase Point.
Okay, thank you very much. Ang galing.
Thank you, Doc.
So yan. Next. Okay, let me explain a little bit about the 5 Shu. All you have to remember are the points from the what's this? The elbow to the tips of the fingers, and then or the ankle to the toes, no? So as you can see, may dynamic changes nangyayari sa ating chi, no? So the first point is the well point, but it's the chi is superficial here, and then it quickens when it reaches this part, so river, where the channel broadens and gets deeper and deeper. And pagdating sa C, nagpa-plunge siya deep into the body. So another one is looking at the channel as a river. So dito sa well points, which are in the nail, no, sa mga nail points, ang movement ng chi is outward. So outward is centrifugal, palabas. And then it becomes more swift pagdating sa spring. And then sa stream, the chi will pour through, and dito po nag-gather ang defensive chi. That is why if we have, let's say, meron tayong pathogenic factor na pumasok sa atin, we always look at the stream points, the Shu stream, to actually help us out, like P syndrome. Then it flows to the river, where the flow of chi is wider and deeper, and where the pathogenic factors are now diverted to joints. And finally to the C, so elbow and knee, okay, where the chi is vascular, and this time the movement of the chi is inward or centripetal. Okay. So what are each of the 5 Shu points called? Sinabi na po ito ni Ma'am Angel: Jingwell, Ying Spring, Shu Stream, Jing River, Hulsi. Okay. Let's call on Ma'am Ami. Ma'am Ami, good evening. Where are all the 5 Shu points located? Ma'am Ami? Or let's go back to Ma'am Angel. Can you answer,
Yes,
Ma'am
Doc.
Angel, the first 10 questions? Okay?
Yes, Doc. So
Saan po
the
nakalocate ang 5 Shu?
number 3 po. 5 Shu Points located. Lahat po sila ay located sa distal to the elbow and knee joints.
Very good. Why do they play an important role sa
Um,
acupuncture?
Because the chi flowing in this portion of the channel is passing through a particularly dynamic change in quality.
So ibig sabihin nagbabago yung flow, yung chi,
Yes, Doc.
no? Kaya napaka-effective siya. Okay. Next, what is the Jingwell point of the lung channel?
Jingwell point of the lung channel is lung 11.
Great. What is the Jingwell point of the spleen channel?
Spleen channel, Jingwell point is spleen 1.
What is the Jingwell point of the heart channel?
Jingwell point of the heart channel is heart 9.
Great. Okay. What is the Jingwell point of the kidney channel?
Kidney channel po is kidney 1.
Okay. Jingwell point of the pericardium channel?
Pericardium 9.
Great. What is the Jingwell point of the liver channel?
Liver 1.
Nandyan po liver 1. What is the Jingwell point of the large intestine channel?
Large intestine 1.
Okay, lahat-lahatin na natin hanggang 20 ka na, 25. What is the Jingwell point of the stomach channel?
Stomach channel po is stomach 45.
Great. What is the Jingwell point of the small intestine channel?
Small intestine 1.
Jingwell point of the bladder channel?
Bladder 67.
Jingwell point of the Sanjiao channel?
Sanjiao 1.
Jingwell point of the gallbladder channel?
Gallbladder 44.
Ying spring point of the lung channel?
Okay, so yung spring point of the lung channel is lung 10.
Great. Ying spring point of the spleen channel?
Spleen 2.
Ying spring point of the heart channel?
Heart 8 po.
Where are the Jingwell points located?
Okay, Doc. So mapapansin natin lahat po sila located sa tips of finger or toes.
Okay, great. Okay, para saan po ang Jingwell points?
Okay, Jingwell points po as indicated for mental illness, fainting, pain and inflammation, especially pag full heat, affects the opposite end of the channel, fullness in the chest below the heart, excess fire, condition within the organ, more so than the meridian. So maganda rin po to, Doc, sa reviving point po.
So it's more of affecting the organs than the
Yes, Doc.
meridians, no? Lalo na
Yes,
pag may excess fire, especially pag nag-liver yang rising tapos tumaas, no? So we, of course, worried tayo pag umabot na sa organ. So it's more of like the fire in the organ, excess fire. If you remember, we use the Jingwell points to resuscitate the patient, no? Especially pag na-stroke. All Jingwell points, pwede mong i-prick 2 to 3 drops of blood each. So where does the chi of the meridian begin to bubble?
Okay, ang answer ko po, Doc, is Jingwell po.
Okay, very good. Where does the chi of the meridian start to gather pace and gush forward? Nag-uumpisa mag-ano?
From Doc, sa Ying spring po, Doc.
Okay, kaya tinawag itong spring point kasi dito nag-uumpisa magrumagasa yung chi, no?
Yes, Doc.
What are the para saan po ang Ying spring? Earlier you mentioned that the Jingwell points are good for fire in the organ.
Yes, Doc.
So para saan naman itong Ying spring?
So si Ying spring po, Doc, treats fire in the body, fever and complexion changes, balance fire and water in the body. So good na good din po siya sa Doc, sa fire.
Yeah, but ang focus natin dito is more on the heat. Kasi
Yes.
pag fire, doon po tayo. Kasi pag fire, alam naman natin na ma-involve na po yung ating mga organs, no? So for Ying spring points, we use them more for heat.
Clear hit po, Doc.
Although pwede din siyang gamitin for fire, but for both meridian and organ, but they would come in more useful for the heat. Okay?
Yes, Doc.
I hope everybody got that. Okay? So when it comes to fire within the organ, more than the meridian, we use the Jingwell. But pag heat lang po, both meridian and organ, then we would choose, syempre mas grabe yung fire, no? So ito kasi, rumaragasan na ang chi. So habang heat pa lang, we would use the Ying spring. So, saan po nag-uumpisa mag-flourish ang chi?
Sa, Doc, sa shoestring po.
Very good. Ang galing. See? Can you see now what is happening? Is everybody, can everybody catch up? Next. Para saan naman ang shoestring?
Shoestring are for indicated ng heaviness of the body and pain of the joints.
Okay, very good. Where does the chi of the meridian pour abundantly? Pagkatapos lumalalim na siya, lumalapad than the previous point, which is the shoestring.
Yes. Sa Jing River na po siya, Doc.
Okay, very good. So para saan po ang Jing River?
So Jing River point po is used for treat cough and asthma due to pathogenic cold or heat.
Very good. Galing. Where is chi most flourishing? In fact,
sa Hesse point na po, Doc.
okay. And especially for skin disorders, like we would use the seat points for the young organs, young channels, no? Napaka-effective. So kailan mo gagamitin ulit yung whole seat points?
Niyo-use po siya, Doc, for treatment of the water damp pathogens conditions such as edema, swelling, and diarrhea, and treat disorder of the foot organ.
Okay, very good. Okay, saan po nakalocate ang whole seat points?
Location po niya is at knees or elbows.
Very good. Okay, we'll give you a perfect score.
Thank you, Doc.
Congratulations po. So parang somehow, okay, I hope nobody gets overwhelmed with the number of points. There are actually 60 points. But what is important at this point in time is familiarization, no? So kaya kinakategorize natin po ang mga points. So we're done with the differentiation, and we hope you were able to remember the uses, no? The indications. Okay, I would like to call on Kangina na. Maraming salamat, Ma'am Angel. Thank you very much.
Thank you, Doc.
I would like to call on Ma'am Ami Glorioso for the next question.
Doc.
Okay, can you answer the next 5 questions? 32 to, next 5. Are you ready?
Yes, Doc.
Okay, what are the indications of LI1?
LI1 indication for revived consciousness, clear it, yung throat painful obstruction po, and fullness of the chest.
Okay,
Yun po ang indication.
fullness of the chest.
Yes.
Okay, ano pa po?
Radiating to lateral costa region, dyspnea and cough.
Okay, as we mentioned earlier, it's more of fire, no?
Fire, yes. Clear it.
Yeah, you were right. Maganda siya for throat painful obstruction, deafness, tinnitus, headache. So I would like everyone to really trace the channel ng LI. Then umaabot po ito hanggang sa ilong, opposite side. So it can be very effective for chief fullness of the chest, radiating to the lateral costal region, dyspnea and cough. Okay. What about stomach 45?
Also, Doc, revive for consciousness, swelling of the face, toothache, lockjaw, throat painful obstruction, deviations of the mouth, nosebleed, yellow nasal discharge. Also, fullness and distensions of the chest and abdomen.
Okay, it's like this. Look at it this way. Parang this is the first point or pinaka-last point ng ating stomach channel, no? So we would always connect it with the head, yung opposite. Can you all get it? Okay, does it make sense? Kung titingnan nyo mabuti, of course, we all know that stomach 45 is a Jingwell point. And if you take a look at the first indication, the face, the toothache, okay, particularly the upper jaw, no? Ay nako, this is so effective, stomach 45. I would usually do stomach 45 on the ear, and I'll tell you about it later. Okay, so it all points to like the opposite part. It's like bringing your head down to yung ganon. Can you get me? And also up to the chest and abdomen. Okay, so that's a Jingwell point. So ganun po siya ka-effective. Thank you very much. Can we go to the next, Ma'am Ami? Spleen 1.
Spleen 1 indication, revive consciousness also. Use moxa to stop bleeding. And then hit in the chest, fullness of the chest, and dyspnea inside.
Wow, talagang ni-research niya. Pareho tayong kuha. Okay. Actually, what I like about spleen 1, no? Especially for those who have craving for sweets, I would use spleen 1. But again, you have to be very cautious kasi this is so masakit. No? So instead of using spleen 1 on the foot or on the toe, why don't you look for spleen 1 on the ear? And I tell you, nawawala yung craving mo for sweets. Okay? And also for liver 1, which we will discuss later, yung mga craving for lechon, craving for anything fatty. So for anything sweet, you use spleen 1. But again, it's so masakit in that area. Look for, I think I gave you, for those who don't have a copy, you message me. I'll give you a copy of that beautiful book on auriculotherapy. And I'm sure Dr. Sam has it. Ay nako, you look for spleen 1 there. Kasi we have also the spleen channel on the ear. Kasi like what most people use as an ear chart, these are actually the tonification points, no? Like if you want to tonify the spleen, you wouldn't want to, this may not be able to help actually do something about your craving. So if you want to be specific about it, use spleen 1. So you have to locate spleen 1, yung sa book na yon. Okay. Next, Ma'am Ami, heart 9, indication.
Heart 9 is a well or good point. Pain of the throat of the tongue.
Yeah.
Swollen tongue. Throat painful obstruction. Heat in the mouth. Pain and redness of the eyes. Heat, pain in the chest and lateral costal region.
Okay. Actually, it's heart pain. Heart 9 is actually the tonifying point of the heart, no? So if there is an excess, we would bleed that. And again, of course, when you want to resuscitate, no? Yung medyo nawala na malay. Okay? So I'd like you to take a look at like ito. It can also be very good for pain and redness of the eyes when you have heart pain. That's why what we do not want to happen is aatakehin yung pasyente when there's too much fire. Okay? So you bleed it, but kung hindi naman talaga, kung conscious naman yung patient, locate heart 9 on the ear. Okay? And I tell you, it's so good. It helps. Number 36, SI1 indications, Ma'am Ami.
First, doc promotes lactation, headache, dizziness, red eye, nosebleed, deafness, tinnitus, throat painful obstruction.
Okay. The first indication that you mentioned is actually called an empirical indication. Parang ibig sabihin, we cannot understand why it is good for nursing mothers, yung hindi makapag-lactate, no? So you use SI1. So when you say empirical point, that means we cannot really explain why it works. But again, it works. Okay? So when you use SI1, this is the young part of the heart. Remember, heart and small intestine, they are called the fire element. So pag sobrang init na po, nagko-cross, parang umaabot na po siya sa small intestine. Okay? That's why when you have mouth ulcers, no, canker sores, okay, you might want to sedate this point or bleed SI1. Next, Ma'am Ami, bladder 67.
Use Moxa also to turn the branch fetus. Good for vertic headache, occipital headache, nasal congestion, nosebleed, eye pain, pain of the inner canthus.
Okay. So if you notice again, parang you brought the entire head to the di ba? Can you get it? And what I like about this point is you can do moxa for those who have breech presentation. Pwede mong pwede mong gawing normal siya as long as hindi pa masyadong late. Okay? That's bladder 67. Next, kidney 1. Okay ka pa, ma'am?
Papa, Doc. Kidney 1 indication, good for anchoring chi and yang. And then dizziness, vertic headache, throat painful obstruction also. Inability to swallow and loss of voice.
Okay. Again, I have to caution you, this is very painful. So the patient might even kick you on the face. So try you looking for kidney 1 on the ear instead, no? So as mentioned by Ma'am Ami, these are the indications. So kidney is the water element. So it's basically very effective. Actually, you can, yung mga ano, I'm sure you've heard of people who could, you know, pwedeng lumakad sa fire. Okay, as long as you know how to properly do it. It's because pag hindi ka takot, then you won't ano, hindi ka masusunog. So it's kasi it has this ability to neutralize or to eliminate the heat. You might want to try it. Okay? Okay, but don't blame me for it. Okay. Next is pericardium 9, Ma'am Ami.
Revive consciousness, clear heat, pain at the root of the tongue also.
Yeah.
And then stiffness of the tongue, inability to speak.
Yes. Oo, kasi diba there are times na there are people who have difficulty, especially pag they're almost about to have a heart attack, no? And that's the worst thing that could happen. So why not bleed all the Jingwell points while waiting for the ambulance, okay? So yun. That's pericardium 9. What about Sanjiao 1?
Good for doc, tinnitus, deafness, earache, stiff tongue, pain at root of the tongue, dryness of the mouth, and dry lips.
Okay. Would you like me to give you a copy of the complete one? Like, I'll convert this to PDF format. This is, I don't think you would be able to study this. It's just getting to know lang para you would understand why these are the indications of the Jingwell points, no? And why they are called Jingwell. Okay? So yon. Thank you very much, Ma'am Ami.
Thank you po, Doc.
Kaya pa ng energy mo. Lubos
Hindi na po.
mo na. GB44.
GB44. GB44 for headache also. Dizziness, tinnitus, swelling and pain of the eyes.
Okay. Yeah. And this is actually the partner of the liver. In fact, pag masyado ka ng stress, masyado ka nagalit, these are the things that could happen. Okay? So that is why we need to know kung sino yung interior, exterior partner ng gallbladder. Okay? And that's why I would like to invite all of you. It will be very informal on Friday, 7 to 8. We hope to be able to have discuss anger, and how to manage anger using acupuncture. Isn't that and how anger can actually bring us a lot of other problems. Kaya bawal na pong magalit, especially when you're as old as me. Okay? Okay. Last na po, Ma'am Ami, lubos-lubusin.
Liver 1 indication, Doc, is good for hernia. Bitter taste in the mouth.
Yeah, non-stop.
Sudden heart pain. Yeah, sudden heart pain.
Yes. Okay. Earlier, di ba we mentioned about spleen 1? Spleen 1 is for those who have cravings sa sweets. Liver 1 for those who crave fatty food. Okay? So yon. But again, it's going to be painful, especially if awake yung pasyente. So look for liver 1 on the ear. Okay? Okay, last na talaga, lung 10. Ay, iba na lang. Okay, thank you very much, Ma'am
Thank you,
Ami.
Doc.
Sumobra na yata. Okay. I'd
Thank you
like to
po.
call on... Okay, Ma'am SP de la Cruz. Ma'am SP, kaya pa ng powers?
Yes, Doc.
Okay. Ginagamit mo ba yung lung 10?
Yes, Doc. Minsan po. Pagka
Okay.
meron po siyang ano po.
Okay. Happy ka ba sa result ng lung 10? Kailan mo ginagamit siya?
Minsan lang po, Doc eh.
Pag may heat, di ba? So can you tell us indications ng lung 10?
Indications, cough, ano to? Hemoptysis,
Hemoptysis. Okay.
sore throat,
Okay.
aphonia, and fever.
Can you explain to us what hemoptysis is? Bakit nagkakaroon ng hemoptysis? That's coughing out blood, no? Okay, because of heat. Di ba kanina sinabi, this is a yin spring point, remember? And compared to the Jing well, we use the yin spring for heat conditions. Kaya this is basically about relieving heat or clearing the heat, okay, from the throat. Nako, this area, kahit i-ano mo lang, especially now, I've seen a lot of patients na having dry cough because of the weather. So you just try to, apply pressure there, lung 10. Okay? So this is all about heat. Does it make sense? So, or, para mas ma-amaze yung patient, why don't you use lung 10 on the ear? Okay? See? It's all about heat. Okay, Ma'am SP, can you tell us the indications for LI2? Siyempre, about heat din ito. But again, what particular part of the body are we talking about here?
LI2. Indication, Doc? For toothache and pain and swelling of the throat.
So
Fever
nakita
po, Doc.
nyo, for heat disorders affecting the upper portion of the channel in the face and head. Okay? So, connecting to the face and head. Okay. Next, stomach 44, Ma'am SP. So, heat pa rin. Like, ano na naman?
Stomach 44. Teka lang po, indication for 44.
Okay.
For ano, Doc, abdominal distension po, constipation po, Doc.
Okay. Pag may heat din, no? May heat, yung medyo tight tuyo yung dumi. And alam naman natin lahat that the partner of the, okay, do you remember, what is the name of the stomach channel, Ma'am SP? Do you remember? Stomach channel of foot
Stomach channel.
Foot Yang Ming, remember? Yes? Sino pong part ng stomach channel of Foot Yang Ming? So, siyempre, you need to know sino po si Hand Yang Ming. No? So, it's the large intestine channel of Hand Yang Ming. So, ibig sabihin, pag may issue tayo sa stomach channel, it can also affect the large intestine. That is why, pag meron tayong damp heat, this is very effective because it can somehow mitigate, no, or eliminate the heat. Okay? What about spleen 2? Heat din ba yung pinag-uusapan dito? Remember, this is still yin spring. Heat din,
Spleen
no?
2, Doc. Hindi ko pa na-try yung spleen 2, Doc.
So, syempre, ito na yung damp heat sa spleen. Kaya merong, okay, by the way, I have a question. Like, you've been practicing for, you've been studying, no? Okay, how would you know if may damp heat yung patient based on the pulse and the tongue?
Damp heat po. Minsan po, Doc, nakikita ko po pag ko po, mainit po ang kanyang skin.
Yes.
At minsan may pagka-reddish po.
Okay, pag pinulsuhan mo yung pasyente, like, gusto mo confirm na damp heat, ano nararamdaman?
Mabilis po.
Mabilis kasi
po.
the heat.
Yes,
And
Doc.
what else? How are you going to confirm na may dampness? Is the pulse going to be wiry? Is it going to be slippery? Or is it going to be choppy?
meron, ang ano ko po, Dok, pagka may hit po, mabilis po eh. Ano man,
Oo, yung heat yun eh, kasi mabilis, di ba?
yes,
So,
Doc,
ang
yun lang.
tanong ko ngayon, paano mo malalaman na may dampness? Ay, by the way, umpisa muna tayo sa dila. Like, how will
Apa.
you know? Of course, pag may heat, may makikita kang, anong makikita mo? Like, are you going to look at if it's damp heat, are you going to look at the tongue that has no coating or a tongue that has a very thick coating?
Pagka may damp hit po, ang nakikita ko po, ano po siya, ano tawag dito? Ano po, may thick coat na white po,
Sticky
Dok.
yellow coating, di ba?
Yes po,
Yes.
yes, Doc.
Yeah. So, as contrasted to empty heat from a deficiency, right? Ang empty
Yes, Doc.
heat, walang coating, red yung tongue. Ito naman, medyo makapal yung coating at saka pag kasi damp eh, no? So it's sticky yellow coating, right?
Yes, Doc. Yes, Doc.
Kung titingnan mo, talagang magkasama sila. Oh. It affects not only the intestines, the large intestine, also the stomach, right?
Yes, Doc.
Kasi yung partner ni spleen is the stomach. So if the stomach is affected, then the large intestines are also affected. Diba?
Yes, Doc. Yes,
Oh,
Doc.
you know. Kaya yung iba, may epigastric pain, meron pang constipation, may vomiting. What about heartache?
Pag may heart rate po, ang nagpa-palpitation po. Pagka yung pong ano ko sa client ko po, Doc.
Okay, napakaganda nito to treat heart fire. No? So
Yes.
obviously, pag nakita mo yung dila niya, pulang-pula. Tapos lalo na yung niya, no, pulang-pula. And remember, the partner of the heart is the small intestine. So nagka-transmit siya sa small intestine. And sino partner ni small intestine? In regards to polarity, di ba si bladder? Remember? You remember? The small intestine is actually called the small intestine channel of hand Taiyang, right? Ang partner niya si bladder channel of foot Taiyang. Diba? Okay.
Yes, ma'am.
So, kidney 2. Can you tell us about kidney 2 po?
Kidney 2.
Okay.
Ang indication po ng kidney 2, normally sa ano po, mga irregular menstruation po or diabetes po, diarrhea.
Okay. Usually yung mga walang coating yung tongue, nagpula na. So meron silang deficiency heat from the kidneys. Kasi pag masyadong mainit, umaakyat po siya sa upper jaw. Kaya nagkakaroon ng throat issues. Minsan itong coughing of blood, the one you mentioned earlier, hemoptysis, or nagkakaroon ng wasting and thirsting disorder. Okay? So I hope all of you got that. Okay, isa na lang po, PC8.
Hindi ko na yung power.
Parang pareho. Ubos na yung power mo. Okay, sige.
It's
a powerful point.
Indication po for the cardiac pain or mental disorder
Actually,
po.
we do this for patients who are already having delirium. No? So, sana hindi umabot sa ganitong stage yung pasyente natin. Okay, so remember, ano na po ito? Yin and blood levels na. So that means talagang nagko-convulsion na, nagde-delirium na, or meron na po siyang septicemia, no? So, but again, pwede pang makatulong siya just to cool the heart fire. Okay? Yan yung pericardium 8. So again, it can actually, it's a powerful point to clear the heat from the yin and the blood levels. Okay. GB43.
GB43.
Okay, di ba? Si GB is the partner of the liver. So we would be always looking at chi stagnation issues. Di ba? Pag nag-stagnate yung chi mo, may possibility magkakaroon din ng heat. So somehow, hindi lang ang liver mo affected, pati yung gallbladder. So you have to use gallbladder 43. Okay? And the worst thing that could happen there is, pag sobra na yung heat, nagkakaroon na po ng bitter taste. No? And finally, liver 2. This is the principal point to clear liver fire affecting any... ginagamit natin to, lalo na pag pulang-pula na yung mukha, lalo na yung mata niya, nalilisik na sa galit. So again, this is going to be painful. And what I usually do, and I hope we can discuss this on Friday. Okay? Maraming salamat po, Ma'am SP. Hindi ka ba
Thank you,
na-stress?
Doc. Hindi naman po, Doc.
Okay.
Little po. Thank you po.
Thank you din. Okay, tawagan kaya natin ulit si Ma'am Joy. Ma'am Joy Enriquez, I hope you're still awake.
I'm awake, Doc, but I have no answers to that. yung first parts ang may answer ako, Doc. Yan ang tinawag niyo ako talaga dito, so wala akong answer.
Just give it a try. Okay, we all say that the stream point is the third point, right? Except for what channel?
Stream point is the third. Except for what channel, Doc?
Yes.
Yan, wala akong sagot, Doc, kasi hindi
Can
ko
you
talaga
make
siya
a
mahanap
guess? Okay, gallbladder channel. Fourth point siya. Okay? So 45, 44, 43, 42, 41. Diba? GB41. That's actually the stream point. Okay, can you describe the state of the chi at the well points? I think we discussed it earlier.
Hindi ko alam kung tama yung sagot ko dito, Doc.
Isipin mo
That
na nasa well.
it's
Remember,
narrow.
nasa
That
well
it's,
pa siya. Nasa well.
that
Diba?
it's shallow and narrow, Doc. But it's, according sa binasa ko, but it's dynamic because it parang,
outward yung movement niya. No? Yeah, you were right. It's very shallow, very superficial, very unstable. It's like when I'm sure you've seen a well, no? May well ka naman siguro nakita. Pag nag-tapon ka ng pebble, di ba? Like, yung niya, diba? Yung wave niya papalabas. That's what we call the centrifugal movement. Okay?
Yes, Doc.
And what kind of chi gathers at the stream points? And this is the
defensive.
Yes, very good. Wow, ang galing. This one talagang binasa mo, no? So ubusin mo na. Which set of points are often used?
Paubos sa akin. Baka gusto din ni Doc Sam magsagot. Ganun kasi.
Nasasagot niya lahat eh. Okay, anyway.
Sige
Sige.
nga po, Doc.
Pag hindi mo nasagot, siya sasagot.
Ano po yun, Doc?
Yeah, which set of points are used for irritability? If you have been listening to what we have been discussing earlier about sorry. Diyan naman tayo. Okay, di ba? Meron tayong, we discussed the point that we usually use for fire, no?
For
yes, anything that really affects the organ already, right? Oh, ito
yes,
talagang no? Talagang affected na sa organ, irritability, mental. So what set of points are we talking about here?
Doc. Kasama po yan doon sa 5 Shu Points.
Yes, of course. Your answer should be one of the 5.
Mental restlessness.
Fire yan eh, fire. Your
Ano po
favorite
ba ang ng fire? The heart, Doc. Somewhere in the heart.
No.
Tama ba?
Anong klaseng point? Anong klaseng 5 Shu point?
Anong klaseng 5 Shu Point, Doc? Okay. Irritability, mental restlessness, and anxiety. Ano ba nag-clear ng heat, Doc? Jingwell.
Yeah, Jingwell. Very good. Fire, actually. Fire.
Fire.
Fire na siya. Fire sa organ. Next, which points are often used for painful obstruction syndrome? Ito yung tinatawag nating B syndrome. Okay? And we all know that pag meron tayong ganitong klaseng issue, that means we are prone to, especially if we have very weak immune system, very poor defensive chi, then we are so vulnerable to the attacks by external pathogenic factors like wind, diba? Cold, dampness. So what points are we talking about? Any of the five?
Any of the five? Dok, teka lang, Dok, ha. Wait. I want to guess yung Ying Spring, Dok, pero feeling ko it's a shoestring.
So you follow your feeling. So it's shoestring. Okay?
Shoestring, Dok, yung aking
Yes. Very good. What are the lower C points for the large, small intestine, and triple burner?
Ito, Dok, mga points talaga to, right?
Yes.
Teka, Dok. Wait.
Kapit na tayo
For the
matapos.
large intestine, isa lang ba, Dok, o dalawa ang sa ng large intestine?
Hindi, iba yung
Tigdadalawa ba sila?
Sige, isa sila. We're talking about 3
Sabi po ba stomach 37?
Yes. For what is that?
For the large intestine, Doc.
Okay, what else?
And then for the small intestine is stomach 39.
And for the triple
And
burner?
then for the triple burner is urinary bladder 39, Doc.
Ang galing naman. Wow, you really did your
Tama
assignment. I'm so proud. Hindi yan hula
Hindi, etong isang to, Doc, hindi ko siya hinulaan.
Ito, isipin mo mabuti. I think I mentioned this a while ago. Complete the following. The blank points of the blank channels are often used to treat skin diseases. This is very true. So, ibig sabihin, we are talking about any of the 5 shu. Okay? So you choose from Jingwell, Ying Spring, Shu Stream, Jing River, and see.
For skin disease.
What channel? Like yin channel or yang channel? Siyempre, pag sinabi mong skin disease.
Skin disease, Doc, usually yang.
Yes.
Na ano yun,
So,
diba?
anong klaseng point are we talking about? Di ba pag nangangatik ka, minsan namumula. So saan mo siya itatapon? Sa well o sa dagat?
Mommy, look at my favorite airplane.
Sa dagat, Doc.
Okay, very good. The C points of the yang channels are often used to treat skin diseases. Now, giisip ka talaga. Very good. We're proud of you. Sige, tapusin mo na. When are you going to use the 5 Shu points according to seasons? Kung sa bagay, wala yung season natin, wet and dry.
So pag summer, Doc.
Okay, like, yeah, pag summer, like, okay, you'll be talking about points for summer. Diba? So you'll be talking about earth points, probably, yeah. So pag nagbibigay tayo ng prophylaxis, okay? So para hindi tayo magkasakit. Kasi alam nyo, no matter, like ngayon sa New York, sa Canada, I think napakalamig, no? So you want to use the water points already. Okay, for winter. The last, I think second to the last, para matapos na. Complete the following.
If a channel is deficient, we can choose a point on the channel corresponding to the blank end element in order to tonify it. If a channel is deficient, wait lang, Doc, hindi ko kasi actually mag-gets yung question, yung pagka, nito yung pagka, if a channel is deficient, you choose a point on a channel corresponding to the...
Di ba meron tayong tinatawag na mother, meron tayong son, grandmother, meron tayong grandson. Di ba? So,
yes, Doc. So,
so, example, yung heart channel mo napakahina. Okay? So, meron, for every channel, meron yung 5 elements. So, like, okay. Ibig sabihin, anong ng element na yon are you going to use pag mahina siya? Of course, when you talk about the deficient channel, you're going to tonify, right? So ang
Yes,
tanong, anong ito tonify mo? Are you going to tonify the mother element or are you going to tonify the sun element?
Okay, wait. So, Doc, wait. Ang nagsisedate is yung mother. Tama ba? To the sun.
Wait lang, ganito ha.
Tama ba yun?
Simple.
So, ibig sabihin ng magtotonify
Mother.
is yung mother. Ay, hindi, yung sun. Tama ba?
Hindi, anong gagawin mo?
Baliktad.
Sino ito tonify mo? Ang mother o
Child.
the sun?
Yung mother.
Okay, very good. That's it. Ang galing
Ay,
talaga ng
okay.
mga tinray ni Dr. Sam. Grabe. Wow, you're so blessed. And the last one, okay,
Oh
para
my
matapos na
goodness.
tayo.
Heart.
According to the theory of correspondence between the 5 element points and pathogenic factors, which points would you use to clear dampness? Okay, pag dampness, ano bang gagamitin mo dito? Anong klaseng point? Are you going to use fire point? Are you going to use earth point? Metal point? Water? Or ano? And like wind.
Fire point, Doc. Kasi may dampness para ma-quench yung dampness. Tama ba?
Oh, actually, lalong magkakaroon ng damp heat.
Ay, ganun ba yun, Doc? Teka lang. Earth.
Earth
Na lang.
point. Eh kung wind?
Eh di magkakaroon ng cold.
No,
And more
pag wind.
dampness.
Wind. What points are you going to use? Are you going to use water point?
For wind?
Hmm.
Wait,
What
so hindi
element?
pwedeng fire doon, Doc?
Remember, wind yan
Pag wind. Ano bang nag-ano ng
Sabi ko
wind, Doc?
kanina,
Ano
pag
bang
dampness,
nagkakos ng ano ng...
isip-isip pa, sabi ko kanina, pag dampness, gagamit ka ng earth points.
Oo, Doc.
Pag wind,
So,
anong
pag
gagamitin?
wind, hindi mo... Naku, ang hirap naman nito, Doc. Metal.
Okay, isip-isip
Metal.
tayo.
Tama
Pag
ba?
metal,
Wait.
ano bang season ang metal? Like, anong pathogenic factor pag metal?
Dahil it's... Ano po bang ano ng... Usually, Doc, may dryness, di ba? Pagka metal. So, ibig sabihin, yun yung nagkakos ng, ano ba? Ng wind? Ako, Doc. Call a friend.
Anong klaseng points pag wind? Anong element? Pag heat, pag fire point, di ba? Isisedate mo. Pag ano naman, pag malamig, yung water point. Pero kukunin mo yung water para uminit, 'di ba? So ang wind, anong klaseng point? Which element? Ulitin ko ha, 'di ba pag dampness, gagamit ka ng earth point. Eh ngayon, kung wind naman, anong gagamitin mo?
To dispel wind. Wait lang, Doc. Bakit
Isip, go.
Ano po ba nagkakos ng wind?
I know you can do it. Ma'am Janine could come to the rescue, I'm sure.
Ayun. Okay, tita. Tulungan niyo ako.
Wood point, Doc.
Yes! Ang galing naman!
So, bakit po wood point? So, that's my question now.
Wood point. You use wood points. Okay, yung mga batch 2, medyo parang this sounds Greek to you pa ha, but don't worry. Although I hate to say it, but I think you have to subscribe to Acupuncture Matters and watch all the basic TCM there. TCM 101, no? Okay, so don't watch them all at one time. It's a warning. Just, like, I think there were 64 episodes. I'm not so sure, 64, 62. Okay, so you watch one episode. Anyway, one episode would only last for like 45 minutes to 1 hour. So that was a good one, Ma'am Janine. I really, really am
Thank you po
impressed.
sa pag-help.
And actually, you already knew it eh. Oh, di ba? Dampness, earth. Yan. Pag wind, you use wood. Okay, so with that, we would like to say thank you to everyone. I hope you didn't fall asleep. And
Hindi ko po, Dok, in-expect na tatawagin niyo ako doon sa pinaka-last, kaya hindi na ako sabi ko, ay, okay na, magre-relax na ako. Ganun.
okay, so let's call on
Tatawag pa
anyone.
din po pala ako.
Yeah. Okay, can I ask, thank you so much, ang galing mo talaga. Alam ko naman kung magaling talaga. Diba? Okay, Sir Elvis, do you like this? Did you like what transpired today?
Yes, Doc. Marami akong natutunan, Doc.
So natandaan mo na lahat yung points sa arm.
Medyo nakakaito, Doc, pero
Okay.
iba,
Okay, don't worry ha. Paulit-ulit po yung mga muscle. Okay? Yung mga surface anatomy lang pala yon. But actually we already hindi pa tayo nag-discuss sa physiology. So again, if medyo nahabaan kayo dito, medyo mas mahaba po yung part 2, yung week 2. It's the musculoskeletal system, and I want you to read Yuan source points, okay? Together with the musculoskeletal system. Hindi na ako magpapaligoy-ligoy pa. I'd like to thank everyone for joining, and I hope this has stimulated your brains. Oh, thank you so much for the comment, Sir Elvis. Okay, let's ask Dr. Sam, because I'm always open to criticism. Do you like this styles, Dr. Sam?
Yes, Doc. Very siya, Doc, challenging. And parang nasa game ka na ba?
Yeah, remember.
Kumikilos talaga.
Yeah. Una-una, even if you had all the time to look for the answers, no? I feel na parang you still need to internalize everything, right? And this is the reason why we study anatomy. Sa totoo lang, if we do the usual, like, okay, what are the muscles? Oh my God, you'll fall asleep, and that's too boring. But if you teach using ano ba yun sa education, basta something that's very visual, it sticks eh. And, diba? Napansin niyo pa ulit-ulit lang, nagkakamali pa yung iba.
Maganda, Doc, yung paulit-ulit. It really just kind of embeds in the mind. Makes you remember.
And yeah, thank you so much for that comment. And I hope the others also share the same opinion. And we're looking forward to, we hope, it's so impossible to be able to, take up everything. In medicine, we had to study this for a year. That's 2 cents. And of course, we cannot, you cannot digest everything. The reason why we had to study anatomy and physiology is because of the location of the points and when you do assessment of the patient, no? Kasi it is already required for all practitioners to actually have both Eastern and Western techniques. And this is where you get to see the best of both. You get to taste the best of both worlds. Okay? So ganun lang po. We may not actually meet every day, but I expect all of you to really, really look at your notes. And by the way, when you receive your email, meron pong sali dyan ng mga videos. They're not exactly my videos from other YouTube bloggers. Ang ganda ng kanilang you just have to watch them. And somehow paulit-ulit lang po yan. I know that medyo challenging yung last sets, no? Kasi medyo bumagal na yung enthusiasm. Kasi mukhang ang dami-dami na. But again, these are the things, the very same, things that you have to really, really remember. And I tell you, it's going to be fun. So I hope to see you again next week. Wag po kayong magsasawa, and I really had fun doing this. Okay? So thank you so much. Bye, everyone. Open your email now. Thank you. Thank you.
Wala pa yung email, Doc eh. Nag-aabang. Wala pa.
Okay, sige. Buksan nyo na. Devote at least 1 or 2 hours each night. Okay? And watch the videos. They're all nice. Bye po. And good evening.
Bye, Doc.
Bye po.
Thank you.
Good night po,
See you on
everyone.
Wednesday. Bye-bye.
Thank you,
No
everybody.
mistakes,
Thank you.
We're really serious. Yung mga
Enjoy
hindi pa ayusin na. Okay.
Yes,
Opo,
po.
opo.